is AI really here to revolutionize care?
Ooh.
Or are we just handing over our data to big tech and getting sold a very beautifully
Oh,
packaged illusion? They already have a racist AI.
we already have a racist. Not only are we facing that in a healthcare system like
Yeah.
the NHS, but you also have it in a robot, bro.
Yeah. It's a big issue.
It's an actual issue. And that's not a glitch. That's not deeply that's deeply ingrained inequality getting scaled. Like automatically. Did you know that using AI to generate just 100-word email can use up to 500 milliliters of water? That's basically a full water bottle gone for one email.
That was crazy to me.
Let that sink in.
Let that sink in.
Who is paying the price for innovation? Talk about who is paying the price for all the prompts we use on ChatGPT.
Just think about it.
Hello, Globies. Welcome to the World Health Investigation Podcast. My name is Jocelyn.
I'm Edna. We are young global health professionals and your hosts for the World Health Investigation Podcast,
also known as the WHI. We will be discussing all things global health, unpacking the most controversial health and social issues,
as well as promoting new age global health development and equity.
So, Miss Adina, what's the tea today? What's the global health tea?
The global health tea.
In the news this week, an update on the situation in Gaza. It's been 22 months since the Hamas-led attacks on civilians in Israel on 7 October 2023 and the Israeli military's response in Gaza. Right now, Gaza is starving, and it's not an accident. More than 52,000 people have been killed and at least 118,000 injured in Gaza. 90% of Gaza's 2.1 million people have been displaced. You may remember that back in January this year, Israel actually agreed to a ceasefire with Hamas. But by March 2025, Israel had imposed a total blockade on aid into Gaza. So for months, humanitarian supplies, food, medicine, clean water have barely made it to those who need it most. See, normally aid reaches Gaza through 3 channels: airdrops, the United Nations and non-governmental organization deliveries, or through the Gaza Humanitarian Aid Foundation. Now, this foundation is backed by Israel and the USA, but even these are heavily restricted. In July this year, the Israeli military announced that it would pause military actions in some areas in Gaza to quote-unquote improve humanitarian responses, and they have put in place humanitarian corridors. But here's the thing. According to the United Nations Office of the High Commissioner for Human Rights, since May 2025, at least 1,373 Palestinians have been killed while trying to get food. And that includes 859 people killed near Gaza Humanitarian Foundation sites and 514 along aid convoy routes. Under international law, starving civilians and blocking humanitarian relief are war crimes. So months without meaningful aid have led to malnutrition in Gaza, which has reached catastrophic levels. Children, pregnant women, and the elderly are suffering the most. This crisis is completely human-made. Policies by Israel have intentionally limited life-saving aid. Israel's actions in Palestine continue to be mind-blowingly inhumane, and they need to immediately allow humanitarian access and guarantee the safety of aid workers and those seeking humanitarian assistance so food and medicine can reach those who need it most. And whether it's calling your government, donating to verified aid groups, or simply keeping Gaza in the conversation, we can all continue to push for change.
Now, on to the juiciest part of the episode. What is AI and why should you care? Do you use ChatGPT? Do you use AI?
Of course we do. Who doesn't is the
Who
question.
doesn't?
All right, today we're diving into something that's got everyone talking. From big tech CEOs to your
Yes.
friend who's trying to get ChatGPT to write their Hinge bio.
That sounds personal. Oh my days, let's be real though. ChatGPT might be more charming than some of these guys out here, which is terrifying. But yes, today's main topic is artificial intelligence or AI. What is it? What does it mean for health? And more importantly, what does it mean for you?
Right. Let's start with the basics. Let's make sure we're all operating on the same terminology.
Yes,
You know what I mean?
terminology.
Because they'll throw out LLM, NLP,
Please,
Gen
what's
AI.
all that?
What does it mean?
I need to catch up with the loop. I don't get it.
Yeah.
So
But she does get it.
at its core, AI is a computer system that can do tasks that we normally associate with humans, like learning, decision making, or recognizing faces.
And under that big AI umbrella, you've got stuff like natural language processing or NLP for short.
Okay.
Yeah.
So that's what NLP stands
That's
for.
what it stands for.
See, even I'm learning as well, but listen, I'm here to teach too. So, NLP is what helps machines understand and respond to human language. What does it mean? It's how your phone knows what you mean when you say, remind me to call mom, or how Google finishes your sentences before you do.
So it's also the tech behind voice assistants like Siri or Alexa. And of course, behind tools like our good old friend ChatGPT.
Okay. So it's through NLPs that ChatGPT is able to
Yes.
prompt what you think.
Yes,
You're about to
yes.
say.
It can process the natural language.
The natural language,
Yes.
right. Which brings us to generative AI and large language models, or LLMs. These are giant computer models trained on massive amounts of text from books, websites, memes, Kanye West racist rants, the whole internet buffet.
Honestly, that man is on one.
No.
So, large language models learn the structure of language by taking in all that data when they use that knowledge, and then they use that knowledge to predict what words should come next.
Okay,
Yeah.
so it's not magic.
No,
It's not.
no, it's just statistics.
So when you ask ChatGPT to write a friendly but professional email to your coworker, that's a large language model doing its thing.
But the key part to understand is that these models don't actually understand language like the way we do.
Okay.
They are just really, really good at guessing what comes next based on patterns. That's basically what's going on.
So it's like it keeps track of the patterns and then is able to feed back based
Yeah.
on what it knows.
Yeah.
Okay. And how good that AI is at guessing or predicting depends on the data you feed it with. So garbage in, garbage out.
Absolutely. And so, with AI already being used in health, it's time we really ask ourselves, is AI really here to revolutionize care? Or are we just handing over our data to big tech and getting sold a very beautifully packaged illusion?
Girl, I don't know. I don't like that. You're
I know
scaring me.
we have to go
Yes,
here,
you're
guys.
scaring
We
me.
have to go there. I'm sorry.
She went there.
Mhm.
No, you actually went there.
I did.
So let's start with what some of the potential benefit of AI is. What could it be for health? What are the benefits of AI for health?
Yeah. Okay. So try to picture this. You're a nurse in a remote village up in the mountains somewhere. The Wi-Fi is trash. There's like one doctor for 5,000 people in the whole village.
Yeah.
And suddenly, an AI-powered diagnostic tool can be used on your phone.
Oh, see, AI could help bridge gaps in healthcare access, especially in underserved areas.
Plus, AI can crunch massive amounts of data for global health surveillance. Think early warning systems for disease outbreaks, tailored community health interventions, or spotting, vaccine misinformation before it spreads.
Oh, especially with all them vaccine hesitant people.
Yeah, they're out there.
You're gonna have your evidence now. So what's AI actually doing in global health right now?
Spoiler alert, it's not just robot doctors or chatbots giving you wrong medical advice. Okay, like people are actually using AI like for real.
For real, for real.
Like there's some really cool work out there.
Okay. So let's start with a company called Blue Dot. Blue Dot, this Canadian health surveillance startup, spotted something strange happening in Wuhan 9 days before the World Health Organization released its statement alerting governments and people to the emergence of a new coronavirus.
Imagine they were 9 days ahead of WHO. They were picking up signals from news reports, statements from official public health organizations, airline ticketing data in 65 languages
That's a lot.
at the same time.
At the same time.
Just like that, and it was able to actually flag a cluster of pneumonia cases that turned out to be COVID-19.
COVID-19.
Yeah.
I mean, 65 languages? I promise you, no amount of Duolingo can allow one brain to do that.
No.
Like, not even if the owl threatened your whole family.
No. Not 65 languages.
65.
But yeah, this was all powered by natural language processing, the thing that we just spoke about, and just machine learning in general.
Whoa,
Yeah.
I'm still deep in the 65 languages.
Right?
Sorry.
It's a lot.
Okay, now let's take it to the motherland, right? Continent, Nigeria to be exact. Have you ever heard of RXO? What is RXO?
RXO. So this is a Nigerian startup that built a handheld nanoscanner that can tell you if your medications are legit or fake.
Okay, so it's like the courtroom for medications.
I
It
guess.
scans the medication in 20 seconds and use AI to analyze the drug's infrared fingerprints, like CSI, but for counterfeit medicine.
It's actually 97% accurate. Plus, they actually produce a heat map to actually show where all these fake medicines are showing up, so that they can help governments and pharma crack down.
Okay,
Isn't
so
that
we
super
have a
cool?
whole courtroom
We have a whole courtroom.
for medical accuracy.
Yeah, to spot all those like fake medicines that are out there.
So it's very accurate.
It's 97% accurate.
97% accurate.
Yeah.
Wow.
So yeah, as we're saying, AI is already saving lives. It's detecting pandemics, protecting patients, and fighting fake medicines.
This is the kind of stuff that makes us want to believe the hype. I'm sold.
You're sold?
I'm sold.
Are you sure?
But what could be missing?
Yeah. That's the key question.
What could be missing? That's my question.
So key issue number 1, guys. We know with great power comes great algorithmic bias. Yeah.
I thought you were going to say great responsibility, but here's the tea now. AI learns from data. But if the data is biased, let's say most of it comes from white Western population, then AI's decisions will also be biased.
Exactly. So there's actually one study that showed an AI tool used in in US hospitals was less likely to refer black patients for extra care even when they were just as sick as the white patients. Isn't that crazy?
That is crazy.
They already have a racist AI.
We already have a racist. Not only are we facing that in our healthcare system like the NHS, but you also have it in a robot, bro.
Yeah. It's a big issue.
It's an actual issue. And that's not a glitch. That's not deeply that's deeply ingrained inequality getting scaled. Like automatically.
So if the data we feed AI is biased, its predictions and diagnosis will also be biased, potentially reinforcing existing healthcare disparities.
And that can be even more difficult to challenge because now it's a whole system. Anyways, this is why before we get into deep and start using biased AI for health, we need to demand inclusive data sets from AI developers.
We also need AI development teams that reflect the diversity of the people that use these tools and that these tools are actually meant to serve.
Ooh. Say it louder for the people in the back, because how much representation do we get in these AI developers?
Honestly, not much.
Not much.
I bet not much.
So if all these developers are like white males, then what do we expect from the data?
Exactly. Probably white men.
White men? Wow.
Yeah. Now on to key issue number 2. And we're sure it's one that these big tech companies don't want you or I to think about too much. The environmental cost of AI.
Right.
Yep. We're going to have to go there, guys.
Yes.
Because it's not looking good so far. It's not looking good.
Did you know that using AI to generate just 100-word email can use up to 500 milliliters of water? That's basically a full water bottle gone for one email.
That was crazy to me.
Let that sink in.
Let that sink in. 1 bottle of water just for you to send that email.
A 100-word email.
Yeah.
It's making me have to reevaluate.
I have to rethink.
ChatGPT.
Honestly.
I use ChatGPT as well, but
yeah.
Dang.
Because the thing is, behind every AI tool like ChatGPT, Midjourney, even your favorite TikTok recommendation algorithm are massive data centers. So these are server farms that run 24/7, processing and storing huge amounts of data. And to keep all those machines from overheating, they rely on huge amounts of water for cooling.
Why didn't they tell us that before?
Imagine.
And that might sound okay until you learn where some of these data centers are built. Like in Chile, a country currently going through one of the worst droughts in history. Local communities are already struggling to access water for basic needs. And then big tech shows up. Thirsty.
Honestly, it's so wild. See, what happened was back in 2024, Google had plans to expand their data centers in Santiago in Chile. But this was blocked thanks to protests from environmental organizations.
Okay. And here's a quote from Tracy Duverstein. Hope I'm pronouncing that name right. From a Chilean environmental group from the situation. The data centers itself would use 169 liters of water per second. That's the equivalent of nearly 9 Olympic sized swimming pools every day, which are filled and drained because it isn't reusable water. Given the drought we're experiencing, this is a mind blogging waste.
Honestly, so shocking. And it's not just a climate issue, it's an equity issue. Listen to what Tanya Rodriguez, also from the same Chilean environmental group, said about the real human toll.
Yeah.
Many people used to grow crops. There are places here where they used to grow strawberries, and now they can't do anything. They have to buy everything, and they don't even have water to use in the bathroom. Chile is attractive because of our laws are lax.
Yes.
We've almost no legislation. Plus, there's no political responsibility.
Honestly, I am taken aback by all this. I am also questioning my use as well.
Exactly. Because honestly, it is very, very heartbreaking.
It's heartbreaking. And it shows that when we talk about AI's impact, we need to talk about who is paying the price for innovation. Talk about who is paying the price for all the prompts we use on ChatGPT.
Just think about it. So for us to ensure that AI revolution in healthcare is environmentally sustainable and equitable, we need to make sure that we're pushing AI developers to be transparent about their water and energy use.
Yes.
We also need the burden of data centers to be shared more fairly with other countries. Please, why are you building a data center in a country with drought?
Yes. Why? Common sense is not common.
Make it make sense.
Make it make sense. Okay, so we've talked about algorithmic bias and we've talked about the environmental impact, but there's one more thing we really need to talk about.
What these AI tools know about you.
Hey, we're about to go there. Get ready. Sit down. Prepare your ears. When you're typing away in ChatGPT, it's not just having a convo with you for funsies.
No.
It's collecting what you type, your chat logs, essentially.
That could include stuff like your name, your location, your religious beliefs, even that slightly too honest 2 a.m. conversation you had about your situationships. Sorry.
Oh,
I know it's getting
She
personal.
went there. Oh, and if you upload something like a CV, which has your full name, email, phone number, guess what? It is stored. That convo becomes part of OpenAI's data.
Because the thing is, companies like OpenAI, who own ChatGPT, they use this data to help train the model to make ChatGPT smarter. But that means your chat history becomes part of a massive data set. And the longer your information is stored, the more likely it is also to get exposed to some kind of hack or data breach, because we know it happens. Nothing is ever 100% secure.
So would you recommend people delete their data from there as soon as possible?
I think that's definitely something you should consider doing.
Okay. So now how can we help you? What would we advise you guys? So what can you do to protect yourself? Here are 5 things that you can do to use AI more safely.
Number 1, don't overshare. Guys, ChatGPT, it's a chatbot, not your therapist. I'm begging. Avoid giving it sensitive personal information like your address, medical history, anything you would not want on the internet. Please.
Oh my days. Please tell the TikTok girlies. Use fake names when talking about people you know. Use code names or fake initials. Everything fake. Do not put your real details on there.
No. Number 3, again, don't upload sensitive documents. Don't upload anything that has your contact information, social security. Try to just keep everything generic.
Got you. And number 4, turn on temporary chats. If you're a logged in user, ChatGPT lets you use temporary chats that auto delete after 30 days. Bonus, it also opts you out of having your conversations used for training.
That's very handy.
Yes.
And finally, number 5, use the privacy portal. If you want to delete your past data, like we said, you can go to OpenAI's privacy portal and take advantage of all your digital rights.
Listen, we're not saying don't use ChatGPT.
No.
Use it, but like with any other powerful tool, you've got to protect yourself.
And when in doubt, just maybe ask yourself, if this chat got leaked publicly, would I be okay with my name being attached to it? Think about it first. Just ask yourself.
Or ask, would I be cool with this showing up in a group chat with my boss?
See, guys, these are all good questions, and we've left a link in the description with a really good article that talks through all these things and even gives you a step-by-step guide on how to access the privacy portal, how to enable temporary chats and all that jazz. We highly recommend you just take a second to look through that.
Because we want our globies to be safe and secure.
Absolutely.
We want you to not be exposed.
No, guys, that's not the move. But yeah, so that does it for this episode. I know we've only basically scratched the surface of AI, but we hope you've enjoyed this episode.
We hope you've learned. We hope you've listened. We hope you can tell us more. What do you think? Do you think AI is going to take over further with our data? But thank you for tuning in, and don't forget to like, share, subscribe, follow us on all our socials, which will be added in the description at WHI_podcast on Instagram and Twitter, What Health Investigation on YouTube, LinkedIn. We also have a TikTok account if you have small banter. But thank you so much for listening, and
we'll see you all next time.
Bye.